Hello, everyone. Thank you for tuning in to Informed in 5. Today's guest is Joy Hogge. She has been the Executive Director for Families as Allies since 2011, and today she will be sharing information about the organization as well as the importance of children's mental health awareness. Thank you so much for joining me today, Joy.
Thank you. And I appreciate this opportunity, and I appreciate all of the ways that we partner with Mississippi PTI. We really appreciate you guys very much. So I am Joy Hogue with Families as Allies, and we're the only statewide organization run by and for families of children with some sort of behavioral health challenge. So all of our staff who work directly with families, and then most of our board members are raising or have raised a child with some sort of behavioral health challenge. And we define that pretty broadly. It can be a traditional mental health diagnosis, can be a child who has some other disability and has had challenges dealing with the stress of that, children who've been through trauma, children who might be involved in juvenile justice. So there's, challenges to mental health there with all that stress. And then also families who are engaged with the child welfare system that often causes stress and things that make it harder for children to have positive behavioral health. So that's kind of who we are, and we support each other as families, and then we work together at the systems level to make things better for our children. So we do a lot of training that's on right now online, a lot of parent-to-parent support activities that you can find out by going to our website, which is www.faams.org, or you can call us at 601-355-0915. Then as far as working together at the systems level, some things we do are training with people who work with families and how to engage with them, and supporting families and advocating for what they want for their children, policy research, and we gather data from families. And then we do leadership training with families so that they can serve on different decision-making committees along with policymakers. And that's usually the last Thursday and Friday of every month. And so you can go to our website or follow us on Facebook or subscribe to our newsletter and keep up with that. So those are some of the main things that we do. And then I also wanted to talk, this is a great timing, like you and I were just talking about. May is Mental Health Awareness Month. And then next week is Children's Mental Health Awareness Week. So there will be different things going on. One thing we're very excited about is we're the state chapter of the National Federation of Families, which is the national group of folks made up of families just like us. And they are doing a big event on the 4th, starting at 1 p.m. It's virtual, called Flip the Script. And it's about flipping the script about children's mental health. And they'll have a number of really good speakers. Anyone can join that. And we hope everyone listening to this will also join that. So we're very excited about that and encourage everyone to be a part. We're also looking at locally. We've been talking about how do we want to flip the script in Mississippi. And what we've been talking a lot about is sometimes during awareness events or weeks, there's a lot of emphasis put on, well, you just need to know enough about this, and you need to get over your stigma, especially with mental health, and just feel okay going to get help for yourself or help for your child. And those things are true. Nobody's denying that it's good to go get help for your child or to know as much as you can about mental health. But there's also a danger with those things, that we can start making families feel like, well, it's your problem. If your child doesn't get help, maybe you just didn't get over your stigma. Maybe you just didn't know enough. And so we've been talking about flipping the script from putting so much emphasis on seeking out services in a mental health system to let's create a system where it's just easy to get the kind of help your child needs. So we've been talking about flipping the script, and we're going to be doing a series of interviews in May that will be on our website and in our newsletter about how some groups are already flipping that script and asking others how they would like to, as far as putting the services and supports out where the children really are, and supporting them with things like school and their physical health care, and embedding good mental health practices into those, and what does that look like, and how can that help all children? And then hoping that will grow to moving us from this idea of awareness to more acceptance that children with mental health challenges are everywhere. So we all need to be in the mindset of all kids should just be accepted for who and what they are. And what does that mean about all of us changing and making a world where that's more likely to happen, including looking at good policies to support that, as opposed to putting all the pressure on families to quote unquote get over their stigma and go find that help. So those are some things that are going on with us, and also with Mental Health Awareness Week and Month. So I don't know if there's anything I forgot, but I know you have been great about joining us on a lot of things. So if there's anything I'm forgetting you want to remind me of, please feel free.
Yeah, I just really like to point out that if anyone is not subscribed to your newsletter, that they definitely need to get subscribed to that. It's wonderful. There's so much great information that you put out with trainings and events. So definitely, if you're not on that mailing list, definitely get on there. And I will be sharing information, all of the organization's contact information, as well as Joy's, in the comments with this video. So yes, just follow what they do. There's Families as Allies is wonderful. I have done many of. I'm just going through the leadership training, and it's great. So I definitely encourage families and anyone working with children and families to take part in that, as well as I've been a part of the peer-to-peer meetings as well. Those are great. So much information. So all of your employees and everyone is very wonderful, so helpful, so informative. So definitely take part in everything that y'all are doing. It's wonderful. So again, I just like to thank you so much for coming on today and sharing this wonderful information, and bringing. I love what you said about acceptance versus awareness. If we can flip the script and change our mindset a little, I think that is a step in the right direction for all children and adults with disabilities and mental health challenges. So definitely, I think that's a great mindset to have.
I forgot one thing. I think as part of our partnership, we are scheduled to do 2 webinars with y'all. And I think it's about the system of care and how MAP teams and wraparound can help families. And there's probably families out there who feel like their child might have a pretty significant mental health challenge that are not necessarily finding those services and supports. And those 2 webinars will talk more about that. And I think I cannot remember exactly when they are, but they're coming up in May too. So I'm sorry.
Yeah, we'll definitely promote that on our website, and I know y'all will as well. And again, that's going to be in that newsletter. So definitely check that out. And again, I'll share that information when we get it on our website. So be sure to follow us, our social media, our website, Families as Allies website, and their social media as well. All of that information, like I said, will be included in the comments with this video. Thank you so much for joining me today.
Okay, thanks, Brittany.